Monkeypox, the viral disease that transmits from animals to humans, is back. Just recently, the World Health Organization declared it a global health emergency, which has necessitated urgent and coordinated action to contain its spread and mitigate its impact. According to the Ministry of Health and Social Welfare, this Mpox clade 1 strain has caused fatalities in up to 10% of individuals who have fallen ill in previous outbreaks. Now, since the re-emergence of monkeypox in Nigeria in September 2017, the Nigeria Center for Disease Control and Prevention has continued to respond to cases of the disease from states across the country. While no deaths have been reported in the country, like some other African nations facing severe cases, it is of paramount concern for the nation, especially as the federal government is ramping up efforts to tackle the outbreak through intensified monitoring and screening procedures at all entry points as part of response mechanisms to the threat of the disease. Now, the Nigeria Center for Disease Control is taking steps to fortify Nigeria's defenses. Tonight, on Weekend File, we'll beam our searchlight on strategies of addressing the spread of monkeypox outbreak in Nigeria. We'll be assessing the transmission pattern, diagnostic approach, and all the associated factors useful for mitigating the transmission of the disease. Our guest is the Director General, Nigeria Center for Disease Control and Prevention, Dr. Idris. Thank you very much for joining us. This is Weekend File. I'm Ruth Aguela. First, let's begin with the news. President Bola Tinubu accepted the resignation of the Director General of the National Intelligence Agency, NIA, Ahmed Rufai Abubakar. The outgoing NIA Director General, who was in the State House this Saturday to update the President on national intelligence issues, briefed NTA News after the meeting.
After the briefing, actually, I tendered my resignation, and Mr. President graciously approved and accepted the resignation. I thanked him for giving me the opportunity to serve Nigeria under his transformational leadership for an extended period of 15 months, which is very rare, by the way, to have the opportunity to serve two presidents at a stretch, at a go. So I thanked him very well, and I promised to remain professionally dedicated to our country and to noble causes.
All right, so in this setting of Nigeria, it's rare to witness something like this for someone of your caliber to tender resignation. Nigerians will be curious to know why you're doing this.
There are quite a number of reasons one will do that, some personal, family issues, but nothing very serious actually. And the friendship will continue. I discussed with Mr. President, he understood very well, and I promised to remain seized with issues and the security situations of the country.
Ahmed Rufai Abubakar, who was appointed by former President Muhammadu Buhari, served as the DG NIA for 7 years. Let's flip to other issues. More than 22,500 Nigerians are parading fixed certificates obtained from Ben Republic and Togo. That's between 2019 and 2023. Minister of Education, Professor Tahir Mamman, disclosed this at a media briefing on the ministry's strides since assuming office. He says over 21,600 obtained the certificates from unaccredited universities in Benin Republic within the time frame, while about 1,105 obtained theirs at some unaccredited universities in Togo. He notes that some of the numbers were harvested from records of the National Youth Service Corps and other sources.
Proved is that any person the Secretary of Government will issue a circular to all employers, whether it is public or private, to fish out anybody with certificate from these institutions. That circular probably would have been out by now. And the same thing, the head of service is mandated to fish out in the public service, in the civil service, anybody who is parading certificates from all these institutions.
In another development, representatives of the federal government, led by the Minister of Education, Professor Tahir Mamman, will on Monday meet with officials of the Academic Staff Union of universities and other relevant stakeholders to discuss issues of interest to all parties.
On what ASU has done, ASU has not declared a strike. Please, let us understand the language of ASU. ASU, they are very legalistic. They follow the law to its core. What ASU has done so far is to declare a trade dispute with the government and give the government 21 days. We've been busy since we got that, submission from them, and hopefully we are positive that it will reach the stage that they will go on strike.
The minister notes that most of the contentious issues and grievances have been attended to. And staying with education, one key area of interest for President Bola Tinubu is transforming Nigeria's education sector. Now, this has been demonstrated with a series of reformative policies. 1 year after the pilot's task with this job, Minister of Education, Professor Tahir Mamman, and Minister of State for Education, Dr. Tanko Yusuf says, so far, efforts are yielding results. Zenrit Demil reports.
Upon assuming office, both ministers hit the ground running by carrying out thorough research into the needs, opportunities, challenges, and way forward for the sector. This led to the creation of DOTS policy with focus on data generation, understanding the menace of out-of-school children, teachers training, skills acquisition and development, access to education for all, teachers' welfare, judicious use of funds, and infrastructural development are issues currently being handled, as the minister highlighted the provision of 40,401 infrastructural facilities to schools at various levels and 6,510 to tertiary institutions across the country.
Also developed the National Teacher Education Policy to integrate skills acquisition and development in all courses. Guidelines have been developed for the implementation. We have actually introduced dual mode education for teachers. Now, College of Education in Nigeria can now run courses in NC and degree in teachers education at the same time.
Other notable achievements include the upgrade of curricula to accommodate skills and allow open distance learning options, while also working on addressing issues of internal and external security and safety issues in schools, especially bullying and violence among students.
We have considered the possibility of working with professional bodies to inspect and check facilities of schools across the country.
The minister and myself believe in college system where each person is assigned responsibility and is given close monitoring to ensure that we achieve the mandate of Mr. President.
Going forward, the ministry intends to intensify efforts towards integrating 3.5 million Almajiri and out-of-school children into formal schools, ensure smooth take-up of various new tertiary institutions across the country, among others. In Abuja, Zenred Dingmun, NTA News.
In other news, leadership of the National Assembly has approved the appointment of Bashir Abubakar as Chief Commissioner, Public Complaints Commission. A statement from the Secretary Information Department, Ali Umoro, indicates that commissioners have also been appointed for the 36 states of the Federation and the FCT. The appointees will be inaugurated soon in compliance with provisions of Public Complaints Act. The Public Complaints Commission is established by an act of the National Assembly to conduct investigation on complaints by aggrieved persons over actions of government and private companies. President Bola Ahmed Tinubu has sympathized with the government and the people of Jigawa State over the recent incidents of flooding across the state. The president's message was delivered at the government house in Duse by the Minister of Defense, Muhammad Badaru Abubakar, assuring the Jigawa State government of continuous support to reduce the plight of the victims. Muhammad Musa Askira reports.
The flood has left in its trail 33 fatality, 7,500 houses collapsed, 11,500 farmlands submerged in the 148 communities affected across the 14 local government areas in the state. Commensurating with the government and the victims in the state, President Bola, presented by the Defense Minister Muhammad Badaru Abubakar, said the federal government will stand with Jigawa State in these trying moments.
The President is aware of this problem and he will support the government of Jigawa State to make sure that the reoccurrence of these problems did not continue.
We provide food items, we provide bathings, we provide medications, we provide clean water, and we provide also conveniences.
The minister has announced his personal donation of 20 million naira to support the victims in Dutse. Muhammad Musa Askira, NTA News.
Nigeria's Vice President Kashim Shettima was in Jalingo, Taraba State, to witness the wedding reception of Keziah Kefas, daughter of the Taraba State Governor Agbu Kefas, and Beatrice Josiah Habu. The Vice President, who was the special guest at the reception, prayed for a blissful life for the couple while encouraging them to be tolerant of one another.
As Martin Luther King said, we either learn to live together as brothers or perish together as fools. In Governor Kefas, we have seen a leader who has shown the capacity for inclusivity. Nigeria and Taraba were a kaleidoscope of colors. Any leader worth his salt to reach out across the aisles and embrace tendencies that are not in alignment with him. But because of the quality of leadership, the inclusivity that Governor Kefas is exhibiting is bringing together a community of nations. I'm here because of your quality of leadership. If you are a divisive leader, I will use every platform to criticize you. But you deserve commendation and I want to thank you. I can say very little to the digital couple. I want to wish you marital bliss.
Former President Goodluck Jonathan chaired the wedding reception. Some state governors, ministers, and people from all walks of life were also at the reception. Imo State Governor Hope Uzodinma expresses shock and sorrow over the tragic death of the head coach of Heartland Football Club of Owerri, Christian Obi, in a ghastly motor accident. Governor Hope Uzodinma, on behalf of the state government, says Imo has lost a star. The former Super Eagles player was on his way to Abakaliki with the Heartland team for a pre-season tournament when the accident occurred. The government sends its deepest condolences to the immediate family of the late Christian Obi and prays for the quick recovery of those injured in the accident. Thank you for staying tuned on Weekend File. Strategies, of course, of addressing the mpox outbreak in Nigeria is our focus tonight. But just before we delve into the conversation, let's bring you a background report. The mpox, that's the viral disease that is transmitted from animals to humans, is making a comeback across the globe. Now, while no deaths have been reported in Nigeria, like some other African nations facing severe cases, however, the country is ramping up efforts to tackle the outbreak. But how are these efforts being received by everyday people? Well, the message is really reaching everyone. Let's hear details from Olusheye Adiago.
Facts have evolved that mpox causes flu-like symptoms, skin lesions, and can be fatal, with 4 in 100 cases leading to death.
A mode of transmission between humans and human-to-human transmission, predominantly in Nigeria. You also have the animal-to-human transmission, and yes, in some instances, you can have, environments, to human transmission.
Because of the current circulating strength now, we also encourage every individuals to also ensure that they maintain, a healthy sexual partner.
We have to resume our basic hygiene practices that we have thrown out after the COVID, like washing of hands, wearing of masks in some cases, avoiding crowded areas.
With the disease already declared a public emergency of continental and international concern, scientists are worried about how fast it is spreading.
As we know, it's an exceptional level of alertness where some kind of international coordination is required, and the countries should step up surveillance measures. And of course, Nigeria is not high risk, it's moderate risk, but we need to continue to remain vigilant.
In the mpox epidemiological summary of the Nigerian Center for Disease Control and Prevention, Nigeria has no record of deaths from mpox, but a total of 40 cases have been confirmed out of 830 suspected ones in Abuja. Olusheye Adiagbo, NTA News.
Well, the outbreak of monkeypox, also known as mpox in some parts of Africa, calls for proactive measures by countries across the world to stem its spread. Lagos State Government has always put in place mechanisms to check incidents of tropical diseases. But some residents, however, say very little has been done to sensitize the populace on mpox across the metropolis. Musa Toliat reports.
On August 14 this year, the World Health Organization declared mpox outbreak a public health emergency of international concern. The devastating effects of COVID-19 on world population necessitated the declaration so that proactive measures can be taken in countries where mpox is yet to make its presence felt. Although medical practitioners say mpox is not airborne, the viral disease has tendency to spread rapidly within a short period of time. The influx of people from various entry points, including the seaports, airports, and land borders into Lagos State, gives room for more concern as mpox continues to ravage parts of the African continent.
There are 2 subtypes of this virus. The first subtype, which is referred to as clade 1, originates from Central Africa, while the clade 2 originates from the western parts of Africa. Mpox infection does not have a particular line of management. It is treated symptomatically, which means that if the individual has pain, the other has fever, heart fatigue, muscle pain, so those symptoms are treated. So it is treated symptomatically.
Incidentally, sensitization on mpox is all-time low across the metropolis.
I really don't know much about monkeypox, but I know it's spreading, and I feel like government should create awareness for it, the same way awareness was created for COVID, Ebola.
Indiscriminate waste disposal in some parts of the state also needs urgent attention to ward off any form of epidemic across the state. In Lagos, Musa Toliat, NTA News.
All right, let's bring in our guest, Dr. Idris. He's the Director General, Nigeria Center for Disease Control and Prevention. Dr. Idris, thank you so much for joining us on Weekend File.
My pleasure.
All right, reports we're hearing 40 confirmed cases for Nigeria out of more than 800 suspected cases. Tell us, what exactly is Nigeria contending with?
The figure seems to have changed in the last 24 hours. We now have 43 cases. 33 cases came from Osun State, Enugu, and I think Abuja State. So we have 43 cases in the country right now, out of about 834 suspected cases. Now, basically, well, when the public health emergency of international concern was the WHO and African CDC, we here in Nigeria too activated our emergency operations center. We've appointed our incident manager, and we quickly carried out a risk assessment, dynamic risk assessment on Mpox, using the Mpox technical working group. And basically, they rated the risk level they gave was high risk. But again, our activity should be targeted at those states where we are recording cases. Like I did say, we have 43 cases confirmed from about 20 states. But the interest is that most of those states very close to the Cameroonian border, especially in the south, and southeast, the states recorded the highest number out of the 43 cases. And secondly, we have gotten in touch. We had a session with the sub-national levels. We met with the commissioners of health in various states to ask them also to activate their emergency preparedness and response strategies in those states and come up with their response plans. Some of them have started doing that because from reports we've gathered here, at least Osun State, Rivers State are doing very well, and I think Enugu State. But we've sent out advices to them, telling them what and what to do. We're also supporting them with some information they require in terms of training, in terms of the major area now has to be diagnosis. We're lucky in the sense that all the 43 cases we have in the country are from the Cade 2B type, which is the less serious ones. And we have recorded no death for now, luckily.
But very curious, Dr. Idris, is it treatable?
Well, luckily, it's treatable because the only how it presents is that it presents with the basic symptoms of fever, body aches. Then you start having the rashes that move from accumulation of fluids and then become pus. And it takes some time to dry up. They are infectious, where those secretions are infectious until those skins are dried up. And the easiest way is to get them cleaned. Most times you use calamine lotion, just like you do for skin rashes for smallpox and the calamine lotions. You monitor fever, people who have fever, you give them anti-analgesics to reduce the fever. But the main thing is that you have to be careful for superimposed bacterial infections. And that's why, again, you need to stockpile just in case they get secondly infected. That's probably what kills. Most times, this does not kill, but it disfigures people. And that's why, again, most people don't like coming out because of stigma. And, so one thing we're advising that you should not, people should not stigmatize these patients. But in terms of diagnosis, we will realize that very few laboratories in the country can actually diagnose Mpox. There are very few. What we're trying to do now is get in more laboratories and spread across the country, especially those areas where we are recording cases. Right now, all the cases detected were confirmed from 2 laboratories in Abuja here and Lagos. We've also now added these other labs as part of the network for Mpox. There is the lab in Naima, the lab in Luth, and the lab in SGIT in Osogbo there. We are looking at scaling up the two laboratories in the south-south, perhaps the University of Port Harcourt and Enugu.
Okay.
They have laboratories that can actually diagnose it. All they need is reagents, and which we are going to supply to them, and consumables, and then train their staff so that they're able to detect this thing.
Okay. Dr. Idris, it's good you're breaking, efforts being put in place.
Yeah.
But also, it's also necessary, luckily for Nigeria, but unfortunately, because of what we're dealing with, it's grade 2 strain we're talking about, which is not so severe. So there is need for a coordinated multi-sectoral approach, especially in the aspect of surveillance. Now, looking at Lagos as a case study, if we look back to COVID-19 era, we saw how cases, were always more rampant there in Lagos. So what measures are in place in terms of surveillance from your reports?
Like we did say, all the states have been asked to establish their preparedness and response plan, set up their teams to start carrying out, and this response involves surveillance. This time is enhanced surveillance. It involves public awareness systems. They will say, intimating people of how Mpox, what causes Mpox, how it presents, and how it can be prevented. They should ramp up their diagnostic capabilities and increase suspicion amongst the healthcare workers. So in their laboratories, if they see people, talk to the health workers again, if they see people who are presenting with these symptoms, they should refer them to the nearest health facility where some of these samples can be taken. And once the samples are taken, they should be sent to the specific laboratories. Luckily, Lagos has about 3 laboratories there. So I think we'll get in touch with them again so that they can improve on their surveillance activities. But detection is more important because now they need to be able to detect. Lagos, I don't say Lagos doesn't have any problem because they have 3 laboratories. My worry is in the south, and southeast, and that's why we said we needed to boost some of those laboratories in that area. And again, so that at least when they send samples, they don't have to carry samples across long distances. We'll just reduce the turnaround time for these samples. More important again is the public awareness.
Yeah.
Most states are already doing that because we sent out the advisories. They've sent out copies to them on leaflets, jingles, radio jingles, and even pamphlets that they can actually domesticate in their various states, in their various languages again for them to air. I know that in a number of states they are going around from community to community, they're doing community-based surveillance, and they're using the community people again. So this is our going, perhaps again we need to ramp up again, and that's why again we'll soon again meet with the state's commissioners again to advise them. We're sending out a response team from Abuja here to those key states to support them in whatever. More importantly, again, remember the port services have sent out advisories. They've sensitized the airlines again that introduced the declaration forms for people coming in from airlines, especially from those areas where Mpox have been ravaging, especially the Central African Republic, Kenya area, Uganda, even Cameroon.
Okay.
The interesting about Cameroon, cases they've seen in Cameroon involve both clades 1 and clades 2. And that's why we have to be careful, especially in the south-south where cross-border transmission is very likely.
Okay, Dr. Idris, we'll pick up with that. It's very important, especially with the porous nature of some of those entry points. Yeah. Let's take a break. We're back shortly. Stay tuned. Thank you for staying with us on Weekend File. Before we continue with our conversation, Enugu State is one of the places that has been reported to have the outbreak of the disease. Well, the state government says it is complementing federal government's interventions aimed at preventing and halting the spread of the deadly viral infectious disease. Let's hear from Chidi Okorafo.
Nigeria Center for Disease Control, NCDC, had listed the states with the suspected and confirmed cases of Mpox in the country. Enugu, Ebonyi, Abia are states in the southeast and among the states in Nigeria with cases of Mpox virus.
In Enugu, we have activated our emergency operations center for the Mpox disease. In fact, what we have in Enugu State is an integrated health emergency operations center with a committee and then technical working group and then our emergency operations center for operations.
Ebonyi State has also recorded one confirmed case of the Mpox disease in Onitsha Council area, while the affected patient is currently in isolation and undergoing treatment.
The patient is doing well, is recovering. So we also have some suspected cases, which will send sample to NCDC reference laboratory in Abuja. The result of those ones are still being awaited.
Residents are, however, calling on relevant government agencies to create more awareness about the disease. In Enugu, Chidi Okorafo, NTA News.
All right, Dr. Idris, we've seen the report from Enugu. Of course, they're putting their acts in order to contain the spread of the deadly virus. But in terms of intensifying coordination, if this virus must be contained, talking about its spread, international coordination is also required. What kind of support is Nigeria getting from the international community?
Well, we're in touch with the African CDC for the continental coordination. We take part in their weekly seminars, events where they share their data from different countries. Also at the sub-regional level, at the West African Health Organizations, again, we're also involved in that. Then in Nigeria here, we are collaborating with various, most of our partners, WHO, UNICEF, US CDC, Breakthrough Africa, so many of them, because they're supporting in different aspects of our action plans. So, and again, we in Nigeria too now, we are coordinating at the national level, and that's why I said earlier that I've met with the state governments. I told you that we met with them last week. We told them what to do with respect to what they should establish. They submitted their plans, set up their facilities, infrastructure, their staff, their diagnostic capabilities, and just set up the processes. I know that I visited one or two of them. Again, I'm very much impressed with what I saw. And I know River State is doing well. You heard what the Enugu commissioner said. They are trying to, because they were at the meeting we had with them. And we will intensify other efforts again. And we're sending out some other materials to them to assist them in what they need to do.
What about vaccine? We hear there is vaccine when the case when it's highly severe. Does Nigeria have enough, especially for those key areas?
Well, generally, Nigeria doesn't have enough. We don't have the vaccine for now. From what information received from NAFDAC and the Federal Ministry of Health, we're expecting about 10,000 doses from the US.
Okay.
And from what African CDC said, they too are expecting about 10 million doses, and they're likely to give us some. I think MPHCDA, that's the agency that actually deals with vaccines, has made requests and recommendations for that. But I would just say that whatever vaccines that come in will never be enough. So between MPHCDA and us, we're going to sit down again to work out the modalities for distribution. And it's going to be based on vulnerability and susceptibility. We probably target the high-risk groups, like people with HIV, people who are immunocompromised, and especially people who we feel might be suspect or they have risk, like hunters, especially the bushmeat sellers. We need to look at that. But again, there's this controversy. The vaccine that is that we're expecting, they've only been approved for emergency use. And I know that people are very skeptical, and they've started reacting to this. So it requires a lot of public enlightenment again, and how to, because just like you have in COVID, you have vaccine hesitancy. Okay. We had the same thing with cholera vaccines. But my take is that, you see, we don't know, even this vaccine, don't know how long will it last. So our best bet would be to concentrate on control measures, basic control measures.
Yeah, you're talking about its potency, right?
Yeah, with potency. And again, they're still undergoing, they haven't finished their, they go through this process of approval process before they are finally released.
Okay.
Yeah.
Dr. Idris, of course, we can't get tired of talking about awareness, prevention, and control.
Yeah.
Of course, Nigeria is at its peak of vigilance, but very important, the health are vulnerable, to the spread of this infection because they come directly in contact with these patients. What is the provision for them in terms of their protection, sensitization, and also, as you wrap up, sensitization to Nigerians?
That's why, again, we said that part of the advisory we sent to the states has to do with health workers too. Health workers must increase their level of suspicion when they see cases. And as they come in contact with these cases, they have to invoke these infection prevention and control measures. They need to protect themselves. That's one. That's why before they touch any of these patients again, they must have the proper PPEs. They use gowns, they use their masks, they use their gloves, and again, it changes as they move from one patient to the other. So that they need to protect themselves first again. That's what we're saying. And I believe, again, when the vaccines come, they may be one of the prioritized priority persons. But more importantly, again, is that whenever they're touching this case, any materials that were used for a case should be disinfected or disposed of and use a different thing. So the workers themselves, it's part of the IPC training we're giving them again, and it's part of the advisory we send to all the states. Because the advisory involves both healthcare workers and the people themselves, what they should do or what they shouldn't do.
What about for people?
For people, we know that Mpox, we know how Mpox is basically a disease of animals that get transmitted to human beings. But in this country right now, we have more of the human-to-human transmission. So when you see any patient, any people presenting with us this disease, these symptoms, especially those of them that have rashes, that you don't know the source of the rashes, first of all, let them report to the nearest healthcare facilities. Try as much as possible to avoid these people. If you are going to be contact, do not touch, or you have to protect yourself before you touch. And again, we know how this is carried through rodents, squirrels, and monkeys. So if you know of it, if you see of any of these animals that appear ill, do not touch them. We have hunters, people who go to this wildlife to hunt these animals, especially bushmeat. If you want to eat bushmeat, ensure that these bushmeat are properly cooked. And again, anybody that's trading bushmeats, again, they need to be properly protected. And that's where the healthcare workers too, the public health officials need to visit this, including the officials of the Ministry of Agriculture. They need to look into this again, because we're actually working along with them again, under the One Health platform. So these are the things, again, anybody you see with these symptoms, with skin rashes, let them report to the nearest health facility. Try as much as possible to avoid contact with them.
All right.
Or any secretions from their bodies.
Okay.
That way, at least you don't get infected.
Thank you very much, Dr. Idris. We'll continue to monitor developments, and for us in NTA, we'll continue to raise the bar on awareness campaign. Thank you for the efforts being made. He is the DG, Nigeria Center for Disease Control and Prevention.
Thank you very much.
You're welcome. Let's go on a break. We'll be back. Stay tuned.
Informed conversation on enforcing local government autonomy on the table as federal government sets up interministerial committee to facilitate the Supreme Court judgment on local government autonomy. That is our focus on NTA Tuesday Live, coming up on the 27th August 2024. Tuesday Live, every Tuesday at 10:30 p.m. It promises to be incisive, educative as ever. Join us.
Imagine a world where your potential isn't limited by your bank account, where your financial dreams can become reality. That world is here with the Nigerian Consumer Credit Corporation scheme, Credico. Credico is one of President Tinubu's initiatives designed to put the power of consumer credit in the hands of working Nigerians. Here to help you achieve your goals, whether it's providing for your family or expanding your home or business. Visit www.credico.ng today for details. This is the renewed hope.
Effective service delivery. Quick intervention for progress and development in all sectors remain a recurring desire of Nigerians. To bridge these gaps and accelerate improvement in the people's living conditions, President Bola Tinubu hits the ground running, signing performance bond administration's foot soldiers. Reshaping Democracy debuts on the NTA, putting the 8 presidential priority areas and the implementers on a scale, holding MDAs accountable. Keep a date with the NTA every Tuesday at 10:05 p.m. as we assess government's performance and reshape the nation's democracy.
The federal government of Nigeria warns vandals of national assets, electricity transmission towers, cables and other facilities to desist from this act of sabotage. Vandalism is a serious crime punishable under the law. Vandalizing electrical equipment will affect millions of Nigerians, including your loved ones. Remember that national assets belong to all of us, hence the need to protect them. Report all cases of suspicious movement around electrical facilities to security agencies. When you see something, say something. This message is from the Federal Ministry of Information and National Orientation in collaboration with the National Counter-Terrorism Center, NCTC, Office of the National Security Advisor.
Welcome back. On global news, Ukraine marks 33 years of its independence as the country continues to fend off Russia's ongoing military aggression. Comfort Fashion brings us details.
Ukrainian President Volodymyr Zelensky and First Lady Olena Zelensky lay flowers at the Wall of Heroes Memorial in Kyiv to commemorate Ukraine's 33rd Independence Day. Somber atmosphere pervaded the country's 33rd Independence Day as the nation's war against Russia's aggression reaches a 30-month milestone. Meanwhile, the countries announced on Saturday the exchange of 115 prisoners of war each, just over 2 weeks after Kyiv launched a surprise incursion into Russia's Kursk region. And nearly 300,000 Bangladeshis were taken refuge in emergency shelters from flood that wrought havoc in Bangladesh as the country recovers from weeks of political upheaval. The death toll is almost a score now, and millions more caught in the deluge. While from the African front, Libyan armed groups and authorities have reached an accord in Tripoli to secure important infrastructure. The country's interior minister announced following concern from the UN over recent fighting and a brewing crisis surrounding the country's central bank. Comforts, Fashim, NTA News.
All right, and let's get highlights from the world of sports. Is standing by for details. Francisca.
Thank you, Ruth. Welcome to Sport Updates. Samson Siasia is back in football-related activities after completing a 5-year ban by FIFA. The former Super Eagles forward who led Nigeria to Olympics men's football silver and bronze medals in 2008 and 2016 expressed openness to coach the Super Eagles if approached by the Nigerian Football Federation. He reiterated the challenges in making the Super Eagles successful again and called for patience during a novelty match to honor his birthday in Abuja.
I believe the NFF will come up with a system where, they watch everything that's going on from the under-17 to the Super Eagles. I mean, the Super Eagles team, coach, will be the head of all the other teams so that they can put structure and discipline into those players.
Not happy with the news of Manchester United loss, but it's all good. Let's find out how the weather for tomorrow would look like.
A warm welcome. We expect weather systems to give thunderstorms to parts of Borno, Yobe, Gombe, Bauchi, Adamawa, Taraba, as well as the central cities of Benue, Nasarawa, Plateau, and the territory. These storms are expected to spill into the afternoon and evening hours, and this should be more intense over the eastern flank of the northeast. However, the southern region will be a bit stable by morning, but there are better chances for cloud buildup in the afternoon and late evening hours to give light to moderate rains intermittently across the inland cities of the south and the coastal belts. Talking about parts of Ekiti, Ondo, Oyo, Osun, Ogun, Lagos, some parts of Imo, Bayelsa, and Cross River State. Please stay tuned for the temperature updates. I remain Joyce Ogunleye, and I'll see you again.
All right, this is what we call it a night on Weekend File. Thank you for your company. Do have a lovely night rest. I'm Ruth Agowele.